Welcome to Healthcare Experience Matters. This podcast is brought to you by the Healthcare Experience Foundation. And with today's episode, we're teaming with PRC. This podcast is dedicated to transforming the healthcare experience so that every person can receive and deliver the best care. Hello, Healthcare Experience Matters listeners. I'm really excited to introduce you to today's episode with Jeff Robbins, Director of Coaching here at the Healthcare Experience Foundation. And Jeff is going to present his talk today, Raising the Bar, Restoring a Culture of Civility. And I also want you to be on a lookout for a follow-up episode to today's talk, where I ask Jeff some follow-up questions about this really important topic of restoring a culture of civility.
So Raising the Bar, Restoring a Culture of Civility. This is a live learning event from Healthcare Experience Foundation. And I'm Jeff Robbins. I'm a Director of Coaching for Healthcare Experience Foundation. This is my background. It's about 18 years in healthcare, a lot of different settings. Long-term care, subacute rehab, outpatient rehab, had some good stints in internal medicine, cardiovascular service line, and also psychiatry, which I really enjoyed. Done some speaking on coaching physicians, been in rural healthcare and academic settings. So that is my background. We're going to talk about what is civility, impact of workplace aggression, and a pathway for fostering organizational civility. So maybe some tips and tools kind of get you going as a healthcare leader to work on this issue in healthcare. So this is where we're going to do a little chat, use the chat feature. And I like to do this with either patient experience or anything I talk about. Like, give me just one word of what you feel civility is personally, or it could be in the work, in your work setting, your system, your service line. Just one word to describe civility. One thing that I do with my background in this and what I've been studying and researching, it's complex. It can mean a lot of different things to a lot of different people. But what I feel, and I really understand this, it's respect in action. When you're doing considered conduct and you're being civil, it's respect in action. It's an action thing. And it does the work of empathy. If you're being considerate and you're being kind, you're paying attention, you're listening, you're using kind words, the empathy just pours out of you. So it's respect in action, and it does the work of empathy. Let me do a brief backstory here. When I took a job in psychiatry at an academic institution as a department administrator, and my predecessor left me a couple books. And when I got there, it was right before the pandemic. And when I got there, there's a book on choosing civility. And it was the 25 Rules of Considered Conduct by PM Forney. And if you've ever read that book, it's a really easy read. It's like 25 rules and how to just do life in a really kind way. And the pandemic hit, and I was still going to the hospital. And my chair of the department, we were the only two people there. And I read this book a couple times, and I was still running some clinics, but it gave me some dedicated time to look at this book, understand what Dr. PM Forney was talking about. And it's fascinating. And I'll have a slide that shows the books that I reference in this deck. But in page 4 of this book, a crucial measure of our success is life is the way we treat one another every day of our lives. So true. Especially during the pandemic. The pandemic is putting a magnifying glass on being civil or incivility. One small tool that I've learned in outpatient setting or in an inpatient setting as well, or just anywhere. Our brains are hardwired for threat, as we know. Our brains are always trying to protect us. So when there's a stimulus, like a negative stimulus, or someone's trying to get a reaction out of us, I come back with a response. And so restraint is a value that I've learned to really connect to, and it's our inner designated driver. We have it. We can learn how to bring it up and present to us at any time, whenever we need it. So I ask myself these 4 questions, or at least 2 or 3 questions, when I have a stimulus that's kind of a threat. Do I really want to do this? Do I want to react, or do I want to have not a really great behavior? Is anyone going to be hurt by what I'm going to do? Well, I like having done this. And my favorite one is, what is the positive intention of my response, or my action, or my behavior? I answer those 4 questions in my head. It slows down my reaction, or my response, and I come back with something really meaningful and intentional. So that's a little tool that I've used. restraint, and practice it every day. So let's look at the impact of incivility in healthcare. So this is a Barrel, I think, of a study in March of 2022, like a patient experience study. Consumers feel the impact. And the question was, do you feel that incivility is an issue in healthcare today? 2/3 of the consumers in the survey said yes. 53% agree, and 14% strongly agree. The consumers see it. They know it's an issue. They probably know they're part of the issue. We're all exhausted by the pandemic, and they're seeing the fallout of what's going on here. They acknowledge and identify what they think the reasons why they see this impact in healthcare. Burnout, fatigue, almost 40%. Strain on the healthcare system, 34%. We're exhausted. They're exhausted. We got to wear masks. No, we don't have to wear masks. We have to get screened. I go into all these hospitals across the country. Sometimes I'm getting screened. Sometimes I'm not. And sometimes I'm wearing a mask. Sometimes I'm not. So the confusion, the frustration, it's all just kind of piling on, and people feel it and they acknowledge and identify it. So the costs of incivility in healthcare: decreased productivity. You guys have all seen this in your service lines, your clinics, your units. You've seen this. Loss of your top performers, people leaving, changing departments, or leaving the healthcare industry. Stilted innovation. It just stops dead in its tracks. If you had any projects going on, you had any big initiatives, when there's this vibe of incivility, it just kind of it just stops. Sick time. People miss work, whether they're physically getting ill from this conduct, or they're just skipping out on work, or there's all this cascading negativity. Poor patient experience, poor customer service, poor outcomes, period. And serious compliance violations. Mistakes will be made. People will not disclose information. They're maybe afraid to disclose information of getting bullied or being having something happen to them. So a lot of costs with incivility. Biggest impact, I think, 12% leave and 25% take it out on others. I'm one of the 12% that left my job about a year ago from workplace aggression onto me from a physician. As we know, if you've ever been bullied, or if you've ever had any sort of aggression, usually the person that's bullying you was getting bullied before that. So it's like this cascading bullying and mobbing and aggression, because it's like a vicious figure eight. And so how do you got to figure out how to break that cycle. So this is one of my favorite slides. This is from Cynthia Clark, great book. It's called Core Competencies of Civility in Nursing and Healthcare. Reference this at the end of the talk. I love continuums. I love 2x2s. I love anything that shows me a visual picture of something. This shows you the distracting, annoying, irritating behaviors on one side, which is like the low level incivility, that's what we're going to look at. Then it slides all the way down, microaggressions, bullying, intimidation, mobbing, physical violence, and tragedy on the other side. Aggressive, hostile, violent behaviors. There's a lot there. We've probably all seen ourselves on that continuum at some point in our lives, whether personal or work, but we're just going to focus on the incivility piece right now. So it's from her book. Eye rolling, finger pointing, door slamming, refusing to listen, ignoring, walking away before we finish a conversation, spreading rumors, name calling. Of course, social media makes it really easy to be a bully. And then negative remarks regarding race, ethnicity, weight, age, gender, religion. Great study, I think it was Becker's, talking 6 out of 10 physicians have had an incivility moment with patients making remarks about their age or their race, religion, gender, weight. Physicians feel this as well. When we're talking about incivility, we're talking about patients to staff, staff to staff, providers to providers, providers to staff, leadership to leadership. It's all over the place. Okay. Eye rolling. I think that's so interesting. How many times do we see eye rolling in a meeting? It shows contempt. It's like unstable. It's like you feel like you're stupid when you see someone eye roll you. And it's the very beginning of like this continuum. And if it's not checked, it'll just keep going down. And then you'll see it. I saw it happen to me. In 6 months, I went from eye rolling to feeling physically threatened and putting in a safety ticket on a physician. Let's flip it. Let's look at the benefits of civility. Let's look at the benefits of considerate conduct, okay? Okay. This is pretty obvious, but let's go through them. Reduce medical errors, improve teamwork communication, retention. People want to stay in your unit. They must stay on this floor. Lessens absenteeism, inspires employees to do better, do good things, reduces workplace conflict and drama. There's enough drama to begin with. We don't need more. And patient experience improves, compliance improves, outcomes improve. Reputation. People go out and promote you. They become raving fans. Your loyalty, your brand goes up when there's considerate conduct and civility in your system, your hospital, unit, clinic, or whatever. So let's focus on some quick solutions. Let's say this, a pathway for fostering organizational civility. Number one, you have to enlist leadership support and raising awareness. You're on this call today because you have an interest in it. You're a leader. And so you're going to take some ideas, hopefully, and go to your leadership and say, hey, I may need some people, some volunteers from the system or the clinic or hospital. I may need some capital, some dollars, and I may need some support. I'm going to need support from leadership to make this work. Then you're going to assess the culture, what your civility culture is inside your facility. I'm going to give you a bunch of assessment tools, some links where you can go find those. And then create a team. I created some patient experience councils in some of my institutions. You find the people that have a passion for it, that want to make things better, think differently, bring them together, get them on a team, create action plans, and then deliver it. So just want to focus on civility teams right now. Team of 7 to 9 trusted members, volunteers. They're going to be taking time out. Could be after hours, could be early in the morning or lunchtime. Got to represent rich and diverse ideas, commitment to the mission of your system, your institution, a dedication to psychological safety. They got to feel safe that their ideas are going to be listened to and have that safety. And teamwork and collaboration, huge. The task for the team. You're going to assess the information and develop some data-driven action plans. You're going to do all these assessments, and they may do some one-on-one rounding. They're going to come up with some ideas. What are we going to improve on? And they're going to monitor the effectiveness of the action plan. Whether it's monthly, biweekly, what's going on with our action plan? Are we making progress? And then updating everybody else in the institution. How's it going? Is this worth our time? Do we see value in this? Do we see movement in our metrics that we want to change? I think the civility team idea is really interesting. It's in Dr. Clark's book. There's other steps in how these teams can progress, but this is just the beginning of how do you get a core group of people that are really passionate about this and then go for it. So here are these books that I talked about. There's PM Forney's book, Choosing Civility, the 25 Rules of Considerate Conduct. Highly recommend this book. Mastering Civility, a Manifesto for the Workplace by Christine Porath. And then Cynthia Clark's book that I referenced earlier. A lot of great tools in this book. It's recent. I believe it's February of 2022. So it's brand new. It's a great book. So you're on this call for a reason. It triggered you. You're seeing something in your clinic, unit, service line, system, hospital. Consider taking a leadership role to raise awareness about this negative impact of incivility in your workplace, aggressions, and the positive impact of civility in creating a healthy, productive work environment. Think carefully about who your intended audience is going to be, your leadership, how you're going to present this, who you're going to make the presentation to, what objectives, what are your goals, what are the resources, what assessment tools are you going to use, how are you going to create this team, or how are you going to create this awareness, and what are your strategies that you can recommend for moving civility forward. For me, the reason I am living and breathing this right now is because I went through it, and I guarantee you, I know a lot of you have been through similar things that I've been through. It's out there. It's magnified now with the pandemic and the exhaustion of what we're dealing with right now. Moving forward, go be a civility champion. Take a deep breath, plan well, and seek support. You got this. So microaggressions, you can see microaggressions behind a mask. You can see it in people's eyes, their foreheads, bullying, intimidation. Just to give you a perspective, I had physicians in my hospital who I had never worked with having opinions about me because of my physician that I had an issue with, talking to them and like spreading rumors about me. So that's mobbing. So when other people don't even know you, have a negative feeling about you, it's so scary, and you don't know how to even function. So that's how that can happen in less than 3 months. So I really appreciate you being on. I love talking about this. I'm looking for solutions, thinking differently about civility. I use this book by PM 40 in my own personal life. I know all the rules. And the number one rule is paying attention. And my favorite quote from this book is from a psychiatrist that specializes in ADHD. The only time a human experience only occurs when 2 or more people are paying attention to each other, whether that's me and my girlfriend, or me and my kids, or me or you and your staff member, your subordinate, or your supervisor, physician to patient, PSR or nurse to patient. You got to be paying attention to each other for a moment to happen, for a good experience to happen, or for the best possible outcome to happen. You got to pay attention. A lot of times we're distracted, we're doing something else, we're not paying attention, and that's where things start breaking down. That's when the eye rolling starts and all the contempt.
Thank you for listening to today's episode of Healthcare Experience Matters. Healthcare Experience Matters is brought to you by the Healthcare Experience Foundation, with today's episode teaming with PRC. To learn more, visit healthcareexperience.org. That's healthcareexperience.org.